Hey viewers and listeners, today we will discuss about muscular dystrophy. So basically it's a group of disease that cause progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal genes, which are mutations, interfere with the production of proteins needed to form healthy muscle. There are many kinds of muscular dystrophy. Symptoms of the most common variety begin in childhood, mostly in boys. Other types don't surface until adulthood. So, there is no cure for muscular dystrophy, but medications and therapy can help manage symptoms and slow the course of disease. The main sign of muscular dystrophy is progressive muscle weakness. Specific signs and symptoms begin at different ages and in different muscle groups, depending on the type of muscular dystrophy. This is the most common form, although girls can be carriers and mildly affected. It's much more common in boys, which is Duchenne type muscular dystrophy. Signs and symptoms include frequent falls, difficulty rising from a lying or sitting position, trouble running and jumping, waddling gait, walking on the toes, large calf muscles, muscle pain and stiffness, learning disabilities, delayed growth. The second one is Becker muscular dystrophy. Signs and symptoms are similar to the first one but tend to be milder and progress more slowly. Symptoms generally begin in the teens but might not occur until the mid-20s or later. Some types of muscular dystrophy are defined by a specific feature or by where in the body symptoms begin. Examples include: the first one is myotonic. There is characterized by an inability to relax muscles following contractions. Facial and neck muscles are usually the first to be affected. People with this form typically have long, thin faces, dropping eyelids, and swank-like necks. The second one is facioscapulohumeral. Muscle weakness typically begins in the face, hip, and shoulders. The shoulder blades might stick out like wings when arms are raised. Onset usually occurs in the teenage years but can begin in childhood or as late as 50. Third one is congenital. This type affects boys and girls and is apparent at birth or before age 2. Some forms progress slowly and cause only mild disability, while others progress rapidly and cause severe impairment. The last one is limb girdle. Hip and shoulder muscles are usually affected first. People with this type of muscular dystrophy might have difficulty lifting the front part of the foot and so might trip frequently. Onset usually begins in childhood or the teenage years. Seek medical advice if you notice signs of muscle weakness, such as increased clumsiness and falling, in you or your child. Certain genes are involved in making proteins that protect muscle fibers. Muscular dystrophy occurs when one of these genes is defective. Each form of muscular dystrophy is caused by a genetic mutation particular to that type of the disease. Most of these mutations are inherited. Muscular dystrophy occurs in both sexes and in all ages and races. However, the most common variety, Duchenne, usually occurs in young boys. People with a family history of muscular dystrophy are at higher risk of developing the disease or passing it on to their children. The complications of progressive muscle weakness includes trouble walking, trouble using arms, shortening of muscles or tendons around joints, breathing problems, curved spines, which is scoliosis, heart problems, swelling problems. If the muscles involved with swelling are affected, nutritional problems and aspiration pneumonia can develop. Feeding tubes might be an option. Please like and subscribe my channel and see you guys in the next video.